It's good to develop a routine time and way of measuring your blood pressure. It should be measured in the morning before taking blood pressure medications and in the evening before going to bed. If you get lots of errors, make a note and talk to your healthcare professional. If you have a calculator or use a computer to record your readings, average the morning readings and then average the evening readings. Record the average readings as well as each reading. To help your healthcare professional know if you have high blood pressure should be measured twice in the morning and twice in the evening for 7 days. Though the first day's readings are ignored, the average of the other 6 days is used to help determine whether you have high blood pressure or not. Still, record all of your blood pressure readings and do not remove high or low readings. If you already have high blood pressure, you should measure your blood pressure before each visit to a healthcare professional. It is best to take 2 readings in the morning and in the evening for 6 days just before each appointment. This will help your healthcare professional know how well your treatment is working. Measuring your blood pressure at home can also tell you if your changes to your medication are working. The largest decrease in blood pressure is usually less than 6 weeks after starting a blood pressure medication or increasing the dose. Measuring your blood pressure during the first 6 weeks following a medication change can determine if the change was helpful. 2 readings in the morning and 2 readings in the evening are advised. Home measurement of blood pressure can help you know if lifestyle changes are improving your blood pressure. Making positive lifestyle changes, such as improving your diet, increasing your physical activity, losing weight if you are overweight, and drinking less alcohol will help lower your blood pressure. A diet high in fresh fruits and vegetables and low-fat dairy products, but low in saturated fats and sodium or salt, is very important. Most people will see lower blood pressures within a few weeks of making lifestyle changes. In some people, bigger changes in lifestyle or a longer time is needed before blood pressure comes down. A home blood pressure monitor can show you these changes are working and will help you continue with a healthy lifestyle. Increases in blood pressure also occur if good lifestyle changes are stopped. Blood pressures taken at home are usually lower than in a doctor's office. If your usual blood pressure at home is 135 mm mercury systolic or higher, or 85 mm mercury diastolic or higher, this is considered high blood pressure. Blood pressures in your healthcare professional's office of 140 mm mercury systolic or higher, or 90 mm mercury diastolic or higher are considered high blood pressure. Average readings above these levels indicate you may be at increased risk of heart disease and stroke. If you have diabetes or kidney disease, your blood pressure should be lower. Be sure to discuss what your blood pressure should be with your healthcare professional. Sometimes your healthcare professional may also want to measure your blood pressure with a special monitor that you wear for a full day and night. These monitors can take about 50 readings in 24 hours and can help determine if your blood pressure is too high. It is important to know what to do if your blood pressure is too high or low after measuring it at home. If your blood pressure is unusually low and you feel faint or dizzy, call your healthcare professional for advice on how to change your treatment. Ask your healthcare professional to tell you what the dangerous upper limit is for you and for advice on what you should do if your blood pressure is too high. If you have shortness of breath, swelling of the legs, chest pain, loss of sensation in an arm or a leg, or an inability to speak, these may suggest diseases of the heart or a stroke, and you may need to get treatment right away, even if your blood pressure readings are normal. Remember, do not stop or change the way you take your medication without first checking with your healthcare professional. The Heart and Stroke Foundation at www.heartandstroke.ca/BP has an online program to help you with your blood pressure. This video has reviewed the recommended steps for purchasing and using a home measurement device properly. A summary of all the important steps are included in the next segment. It is important to properly follow these steps and to carefully read and follow the device instructions. If you have questions or trouble measuring your blood pressure or using your device, consult your healthcare professional for assistance. More information on home measurement of blood pressure can be found at www.hypertension.ca/BPC.